One skill you will not be tested on is using a CPAP machine, continuous positive airway pressure. There are a lot of different types of machines. This is the most common type that's used in EMS. It's called the Flow Safe, and I believe this is the Flow Safe 2. They came out with a couple different ones, but they're all pretty similar. So when it comes to you, you have this piece of oxygen tubing with the pressure regulator, I guess it would be called, that's up here at the top. You have a mask, and you have the rubber that attaches the mask to the face and head. So the first thing you would do is assemble your oxygen tank and connect the oxygen tubing to your tank as you would, the same as you would for a non-rebreather or a nasal cannula. One thing that's on the tubing here, it tells you what different liters per minute, what flow rates will give you what centimeters of water for pressure. In EMS, we know we want between 8 and 10 centimeters of water for CPAP therapy, which tells me we're going to need 25 liters per minute. So you may need a special regulator to use this. But once we've attached this to our regulator and our oxygen tank, we now can attach the other end to the mask. And it just fits in there like so. And this also has another gauge on it. So once it's been applied to the patient, you can use this gauge to see how many centimeters of water you're applying to the patient. This mask now fits over the face just like a non-rebreather, like a BVM mask or a pocket mask. You may need to talk the patient through, coach them through tolerating this because it can be very claustrophobic for someone who's having difficulty breathing already. And it may be helpful if at first the patient's able to hold the mask to their face themselves as they get used to it. Remember, they're going to have to forcefully breathe against the mask, so it can be quite challenging. Then you have the headgear, which has these little holes. And notice the mask has these little tabs. So we can just attach the holes like so. The mask will then go around the back of the face, or the headgear would then go around the back of the head. And it will reattach on the other side. And it's very adjustable. Many different holes to make this fit any patient. So once we get it on, we can kind of adjust it to comfort of the patient. And that's how you apply CPAP. If your patient starts to deteriorate at any point, discontinue CPAP immediately.